Hello, everybody. It's Jack Hadley from My Social Practice. Thank you for joining us. And I have a special guest with me I've been looking forward to visiting with. Jacob Baadsgaard is with us from Disruptive Advertising. Hi, Jacob. Thanks for joining me.
Hey, thanks, Jack.
Well, the reason for our visit today, it's a brief visit, but we're preparing for the Dental Digital Marketing Conference next month at the end of April. We're getting really close. We're about 5 or 6 weeks out from the conference. And I wanted to get Jacob on a little video interview here for a minute to have him describe a little bit about disruptive advertising. And they're one of our premier sponsors at the event. And Jacob's going to be giving us a presentation at the event. And so I wanted to visit with him. But before I do, for those of you who are already registered for the conference and are seeing this, we look forward to seeing you. If you are not yet registered, there are still a few seats available. You can check out more about the conference at the URL Dental Marketing Conference, dentalmarketingconference.com. And you can see if it might be a good fit for you and your practice in Las Vegas. It's at the gorgeous Red Rock Casino and Hotel. It'll be a nice time of year. When the conference concludes Saturday at around 1 p.m., a lot of folks are staying and playing in the pool or going to the strip for a day. And so check it out, see if it's a good fit. We only talk about one thing, and that's dental digital marketing. It's a very, very narrow conference. No clinical stuff, no practice management stuff. It's just how to use digital to grow your dental practice, and that's it. So we're looking forward. If you haven't registered, hope to see you there. Check us out. All right. Well, let me ask Jacob, if he would, to just take a minute. Tell those who are watching a little bit about yourself, Jacob, your background, a little bit about disruptive advertising, just so people can get to know you a little bit.
Yeah, you bet. So here from Utah, and excited to be a part of the conference. My background is I was an analytics consultant for enterprise companies for the first few years of my career. And what that means is I would help them implement analytics that would tie the knot between digital marketing and what was actually being produced from a revenue standpoint. And so I saw that some of the largest companies in the world didn't know how to do this. And if they didn't, a lot of the small and medium-sized businesses certainly didn't know how to either. And so that's where I started disruptive advertising. What I found over years of experience is that a lot of the opportunity that I saw was through digital marketing, through Google AdWords and Facebook ads. And kind of what differentiates us is we're a tech-enabled agency. We help our clients connect the dots between digital marketing and what's actually turning into new clients or patients. And we're about 5 years old as a company. I've been growing pretty quickly, based out of here in Utah. And we're actually on the Inc. 500 last year. So it's been a pretty wild ride.
That's great. That's great. And it sounds like you work with quite a few dental practices.
Yeah, we do. We work with a lot of dental practices, which is why we're excited to be here at the conference. Our software, we've actually audited now over 4,000 businesses, digital marketing campaigns on Google and Facebook. And what we found is that 76% of those budgets are completely wasted. Yeah. And most of the time that's because they either lack the bandwidth or the expertise to know how to do this correctly. And so during the conference, that's what I'll be presenting on is, hey, you know what? This is how you do it correctly and the impact and growth that this can have for your practice when you do it this way. And we'll kind of demonstrate, hey, here's how most people do it. And then we'll demonstrate, here's how the people that are doing it the right way are doing it, and the type of growth that they're experiencing for their businesses. And so that's what we plan to review.
That's great. That'll be so applicable to the conference, and we're really looking forward a lot to that topic. It sparks one question in my mind. Let me ask you real quick. Do when you first visit with the dental practice, for the most part, are they not using the kinds of tools that you're talking about, or are they using them and trying to manage them themselves, or are they using them and having other people help manage them? What's the typical scenario?
You know, we actually see quite a bit across the board. And what we see, there's a few common things that we see all practices, generally speaking, not doing very well. Number one is different types of patients are worth more to a practice than others. A general patient versus someone that needs dental implants, for example, is going to be worth a lot more to this practice. Yet in their digital advertising campaigns, they're not focusing the budget on one or the other. It's just kind of a spray and pray and hope that they get new patients into the practice. And so what we've done is, let's make sure we spend the money where it's going to make you the most money. And so those are some things that we've really found specifically in this industry that's just not being done very well. And what's actually quite interesting is that we're finding to get new dental implant patients versus just a general patient costs about the same. So why not spend the money on the ones that are producing a higher revenue ticket item for the practice?
Yeah, it makes sense. I think as I travel and visit with lots of doctors, lots of practices, that seems like this subject is one that brings some fog and some frustration to them, that it's just not clear how you do it and how you do it well. And then in addition to that, I think it's not clear to them a lot of times whether or not they should be trying to dive deep and learn enough themselves to then manage and implement, or to what extent they need a little help. I think it's a real sore spot, frankly, for a lot of doctors who just are frustrated by it. So sounds like you're going to help clear the air a little bit.
Well, that's what we've seen, is that most of the time it's not even a good use of time for the doctor or for the owners to be spending their time on this. Mm-hmm. The solutions that exist in the market, like ourselves, are more cost effective than it would be to spend their own time figuring this out. Now, that being said, we actually do have a lot of groups that do like to take what we teach and go and implement that on their own if they do have the time or expertise to do that.
Good.
But that vast majority don't want to. They just want someone to be able to demonstrate, hey, here's how it works. This is what we'll be doing. And please take this off my plate.
Good. Well, and I appreciate you bringing that point up, Jacob, because one of the premises and value propositions of the conference, since we started it 4 years ago, is that we want to provide maximum value to attendees in that they can either take what they learn at the conference, and if they're the kind of practice that wants to dive in and implement, that they're going to learn what they need to know to do that better. And for those practices that are just unclear, at least they'll leave with clarity as to whether or not they should tackle that. And if it's clear to them that they shouldn't, then obviously there's a lot of people we've invited to the conference that can help them do that. But I think it's really neat that all of our sponsors from the beginning have been really good about educating first. And I can tell based on the comment you just made that, you know, those who really want to dive in are going to learn a lot from your presentation. And of course, those that feel like a company like yours can help them, I'm sure they'll appreciate that, getting to know you as well. So
absolutely. We just, whether we're helping or not, we'd like to see the wasted budgets go away. It's just better for the industry in general.
That's right.
But we'll be jumping into the nitty gritty so that, like you said, those that want to implement on their own, they'll have the tools and resources that they need to.
Good. And for those of our audience who don't know, at this conference, we only have 12 sponsors. And so Jacob and his team will be one of those 12 sponsors. They will have a table in the ballroom where we'll be meeting, and they can visit with you more about what they do in addition to what you'll learn during Jacob's presentation. So anyway, Jacob, tell everybody the URL for your company. So if they want to get to know a little bit more about you before the conference, they can check it out.
Yeah, you bet. It's disruptiveadvertising.com is our URL. And while we're at the conference, at the table, we will be able to provide a free site and AdWords and Facebook audit for those of you that are interested in getting a second set of eyes on that, to say, hey, here's what we're doing, what's right, what's wrong, and we will be glad to provide you. We've actually got a software that we can push a button that will do the audit and give you a lot of insight that you can literally take with you and learn from that. So stop by. We'd love to provide that for you.
That's great. Very helpful, Jacob. Thank you for taking a little bit of time this morning. And I know you are on a hectic schedule, so thanks for carving out a few minutes for us to visit.
Thanks, Jack. Pleasure.
Hey, look forward to seeing you in a few weeks.
All right. Looking forward to it.
Yeah, and then in closing, again, if you want to check out the conference and you don't know where to go to check it out, it's dentalmarketingconference.com. And we'll look forward to seeing all of you in Vegas next month. Thanks, Jacob.
Thanks.